and for medical clearances, most of the time our employee health will have you fill out the questionnaire when you first get hired on. So they usually, and I would say the majority of people are fit to wear the N95 and the PEPR. Very rarely have I received notification that someone is not fit to wear them, but occasionally it happens.
And there are occasional times where I will actually look over somebody's respiratory questionnaire and say, no.
Right.
So don't think I'm just going to, and Sally, who's been through my class, knows that full well. I've told people, no, you're not, no. I'm responsible for you and I'm not letting you do it. All right. Okay, so this is sort of the basic chassis that we have here. Belt that's going to go around your waist. Here's your motor right here.
Yeah, there's a
Here's your standard HEPA filters, which for a hospital is really all you need. Your hose and your mask. So we're going to take off the hose real quick, because we're going to put the flow monitor on there. It kind of goes in there, and this actually comes up to about, what's the line say? Is this 6, still 6? Anyway, there's a line on there, and what you want the ball to do, or the little doodad, is to go above the line. Okay? That means you have enough positive pressure being pulled in through the filters out. A couple things to remember we've discovered: if you're putting fresh filters on, for God's sakes, make sure the caps are off the filters. That's a rookie mistake, and trust me, people make it.
And the expiration date is.
And the expiration date on the filter. Thank you. These filters, if we're in the the time frame, they're good for about 30 days. Although we're going to try and limit the reuse if we can help it. However, when you become shortage, we've got a lifespan of about 30 days. And of course, the battery in here plugs into the wall, and we want to try and keep them plugged in as much as possible. If you get it in there and this sucker does not go all the way up to the line, it either needs to be recharged, but the point is you don't use this machine. Okay? So once you've verified that the flow is okay, and you've checked your system, you've made sure that your cartridges are on, the caps are off.
Yep.
That seems so simple, okay? But we've had people put the decon uniform, the decon suit on, and then they turn the motor on and the caps are off, and we code them, so we don't want to do that. So these are real easy. You don't have to worry about the old metal clamps that have to be tightened in. Those are actually real simple. So here's your thing. So one over here, we're going to strap it on. This will be on the outside of your gown. And it is a two-person process, so there will be a quote-unquote assistant with you that will also make sure that he or she has checked your equipment. But don't rely upon them. I mean, I know a lot of you. I don't know if I trust you to check my equipment. Okay, we see that? Okay,
Pull straps.
There you go, pull the straps. Okay, here you go. Basically, it just sort of slips over. And then what you'll do at this particular point in time is you'll basically just adjust it for comfort. I'm standing in front of you, I apologize. So we turn the motor on. And there you go. All right. Smell anything weird? You should feel a cool breeze coming over that. Having been, during my initial training almost 20 years ago, they tested me out by putting me on a gurney and they laid me on my air hose. And I want you to know this sucker will become very, very claustrophobic, very clouded up, and very warm very quickly. If you feel any of that, you don't feel the air flowing over you, get out of it immediately. You want to feel very comfortable in this thing before you go in there. Because the longer you're in this, and the longer you're in the gowns, and the longer you do physical activity inside this equipment, it is going to become a little bit uncomfortable. So it is up to you to determine how long you feel like you can do this, but if at any particular point in time it becomes unbearable, you need to get out of it. Now, as opposed to, ready? All right, so clean your hands, okay? Pull it off like this, and then what we'll do is somebody in gloves will obviously take the equipment off and then set it somewhere where we can, it's going to have to be cleaned after every use, basically, is what's going to happen. So you're going to have to use a fresh one afterwards, but we will get this. We're still figuring out the mechanism for how to do this. For those of us who are in a beard and didn't shave today, or didn't feel like shaving today, okay? Did everybody see that in Topeka okay? You guys want to, we have 15 minutes.
Hey, Dr. Havoc?
Yes.
There was a question on how often would we need to change those filters? Do they need to be changed? Like if we were taking a PAPR from patient to patient, obviously.
Yeah, that's, hang on just a second. Yeah, so everybody can hear the question. Okay, what's the answer, Linda?
Okay, so right now, if we are doing the onesies and twosies patients, that PAPR and those filters stay with that in the anteroom of where that patient is staying. Those can be reused by multiple providers. You know, they'll have their own hoods and stuff. And that's where Dr. Halleck was saying it can be used for approximately up to 30 days. We'll look at, so these filters collect not just the droplets, but they're also collecting any particles that are in the air. So depending on how long the providers need to be in the room and how much air is going over those filters, they may end up getting clogged up faster, in which case we might have to change them more often than the 30 days. So right now our standard is they stay with the patient. When that patient is discharged, they get thrown away in the red bag and or up to 30 days. If the patient is here longer than 30 days, then we change out the filters at that time. Yes, ma'am?
There's a sign inside out sheet, correct? And how is that, what are you doing with that sign inside out sheet?
We are, so that's kind of to track which PAPR, because there's serial numbers on them, that they can track. So if I'm the patient and I get seen in the ED and they screen me, they're wearing the PAPR, I come back negative, I either have influenza A or influenza B, then they can reuse that PAPR with another patient. Like that PAPR won't follow me. But if they want to move me to an isolation room, those cartridges and or that PAPR would come with me to that, I mean, not on the patient, but it would go to where that patient is going to be housed.
So it's not signing in when you put it on and signing in when you take it off? It's just signing in who's it attached to, correct?
We were looking at seeing for the filter cartridges, and that kind of goes back to that 30 days. We were looking at trying to track how many hours those cartridges were being used so that we could help develop a better change-out schedule.
The sign-in process with your name also verifies that you've been in the PAPR, because that actually counts for a bunch of different things. Let's say you get sick. Well, we know you're in the room, we know you're in the PAPR. Let's say something happens to you while you're in the PAPR, God forbid. We know you've been in the PAPR and we have documentation for it. Later on down the road, if somebody asks you, have you spent any time in the PAPR, because sometimes, you know, they change that on the form, you can say, yep, I spent blah, blah, blah amount of time in the PAPR, okay? One thing I was gonna bring up that I didn't was, and again, when I think about this, I kind of relate it back to my decontamination team. We always have a partner. This is different from the N95 mask. When somebody's in a respirator like this, I always like to have another human being keep an eye on them. Now, the unit, it's pretty easy. We can put them in there with the glass doors and we can watch them like that. Logistically, if it's a door closed like in the emergency department, we may have to figure out a mechanism, but I don't like anybody going into a PAPR because the risks of something going wrong with that, while they're not great, they are a little higher than the N95 mask. I always like to have somebody just kind of keep an eye on that person while they're in the PAPR. Because again, you're relying upon a piece of equipment blowing air over, and if something happens, you know, people have passed out in those. Again, those are very, very low risks, but I don't like to play around. Again, to reiterate, those have been with me on my decontamination team. Safety is paramount when you're putting something like this on. Okay, for those of us who, for whatever reason, cannot fit into an N95 mask. Okay, does that make sense? Okay, again, I stress this. Those of you who know me, you know I will dive into any circumstance, forget life or limb. Don't take chances with this, okay? Again, not that this is any more or any less than any other pathogen we've ever dealt with, but it kind of tells you we just need to play it safe with this. We always take isolation precautions, PPE precautions, with every degree of seriousness that we can, okay? And if it looks like we're overdoing this, well, maybe we are overdoing it, but at this point, I'd rather overdo it and then figure out what this is over time, because we need more data on it, because we just don't know enough about it. So I'd rather overdo it than to get cavalier and underdo it, and the next thing you know, we have, a medical student, a resident, and a staff off with influenza, and we have to quarantine the entire ward, which we've had to do before in Leavenworth, at least I know about. So that's what I'm saying, take it seriously. If things change, we will obviously adapt our protocol as we need to, okay?
And one of the questions I've been getting about the PAPRs, they do have a warning. They'll start to beep when there's about 30 minutes left on the battery charge. And then when you get down to like 5 to 10 minutes left of battery charge, it'll be like a constant beep. So then that's when you know that, it's time to start heading out and swap out either you're done with the patient for that time and or swap out PAPRs to go back in if you need to.
Yes, how many minutes?
It'll start at about 30 minutes before the battery's dead.
So it's got a fair amount of, I like to think about an SCBA tank, an hour tank of 30 minutes.
Right.
Something's gonna let you know that the tank is about half full and you have to start thinking about wrapping things up. And if you're down to 5 minutes,
Yeah.
you better be serious. You better be thinking about getting out of there, because I don't trust a 5-minute warning on something that's helping me breathe.
Yeah.
It's call me crazy. Okay. Here's what I'd say for the remaining 10 minutes. Tamika, if you're okay with that, just have them kind of, I don't want to say play around with the fabric because we need to get people. Do we have enough forms? Do we have enough forms?
I didn't bring any forms.
Okay.
I have another question.
Yes.
It gives